Today I'm going to be doing my postpartum assessment for my patient. I've done all my general practices and safety techniques. I've done my two patient identifier. I've done a complete set of vitals on this patient, and I've recorded those. I've also had my patient to void, and I have explained to the patient the necessary, knowing why we void, why measuring our urine when we void, making sure that she has not got any urine retention whenever she does that. So first I'm going to do is I'm going to expose the breast. And with this, I'm just exposing what I need. If this patient is breastfeeding, I'm going to let them know the importance, well actually if they're not breastfeeding, or if they're breastfeeding or they're not breastfeeding, I want to let them know the importance of wearing a supportive bra. If they're breastfeeding, I'm checking for engorgements, I'm checking for cracks and stuff around the nipples, letting her know to alternate breast each time she breastfeeds. Also I'm going to assess for pain and that kind of thing, and also teach that avoiding stimulation if she is not breastfeeding is recommended. I'm going to move down here to the abdominal area. I'm going to do it a little bit backwards, but I like to do it just because I don't like to, I want to listen to bowel sounds prior to palpating the uterus. We'll listen to the bowel sounds in all four quadrants. Okay. This time I'm going to ask my patient if she is passing gas or if she's had any bowel movements at this time. I'm going to ask her again if she's in any pain, and my patient is not in any pain right now. So I'm going to move to the uterus now, and I'm going to assess the bladder. I want to see if if it's extended, if it's left, right, the uterus that is. And to do so, I'm going to put my hand just above the pubic bone area here, and the other one's going to be at the top of the uterus. What I'm doing, I'm checking the height of it in correlation to the umbilicus. I'm checking the tone of it, and I'm also checking to see if it's flabby, boggy. If it's firm, if it's flabby or boggy, I'm going to massage that. And also at the same time, I want to assess for pain. So my patient is not in any pain, so we're doing pretty good. So I want to move down here to the perineal area. I'm going to take this pad off. I don't have one on here, but I will take this pad off front to back. I'm assessing the pad for the color of it, the odor of the drainage, that kind of thing. I'm also going to roll my patient to check for pulling underneath of her because of the hemorrhage and that kind of thing. Once I have that pad off, I want to teach this patient that if she goes to clean herself, to use the Perry bottle. We want to use that, pat dry, don't wipe real hard, just pat dry. Also going to check at this time, assess the episiotomy if she's had one. Also going to assess the vaginal area for edema, any discoloration, or anything out of the ordinary, that kind of thing. Also, my patient, we probably before delivery, we have done a H&H, we've done, and we'll do one afterwards. We've done a blood type. We want to do a RH factor test. We want to do a rubella titer on these patients also. Once I have this all done, clean her up, I want to put another pad back on from back to front and get her all cleaned back up. So once I got that done, cover her back up. I want to move down here to the extremities. I want to check for edema. Also checking for her reflexes here is the Homan's method. Checking for a thrombus, making sure that she don't have any type of blood clot or anything like that in her leg. My My patient is doing very well today. She's surrounded by her husband and her mother, and they are very supportive of her. And patient is really doing well 24 hours post-delivery. So this time I'm going to lower my bed. I'm going to put my call out back in within reach of my patient. I'm going to do my hand hygiene. I'm going to record a report.